Dr. Bill Adams here, and we're back for the third and final part of the Sientra CVD-19 Crisis Management series. And here is Sandy Roos, who's been giving us pearl after pearl. And this, Sandy, is really going to be about kind of taking back the lead for your practice, you know, and I know you're going to have a lot to add in here, but this is, you know, anticipation is kind of key here. We don't right now know how long things are going to be down. Hopefully it'll be a shorter period than longer period, but you know, we want to be organized. You have some time now. You have probably things you thought about doing in your practice for many years and you hadn't gotten around to doing them. So this is your time to deep clean that. And you know, you want to plan for the future. So it's just like the department stores, you know, they plan their Christmas catalog in July. So they're putting up trees in July because they've got a plan for what's going to go on in the future. And I think that's probably what we should do. And people kind of need to think, who do they want to be when they go back into practice?
Absolutely, and I love that you said that, because really, who do you want to be? Very rarely do you have the opportunity to just like dead stop and really say, okay, this is the time. So many practices, they want to like rebrand themselves and start doing things differently. They just don't have the time or the resources to do so. This is when you should be doing it. I was talking with Terry from the Plastic Surgery channel, and she was like, this is where we need to look at doing video. Updating your videos. If you've never done videos, let's talk about doing them, because they really are critical in marketing. And as time goes on, you know, 10 years ago, they probably weren't used as often as they are now. And so really, let's take that deeper dive, look at the things that, you know, you've always wanted to do, and put a plan in place. I always tell my practices that you have to have a year plan out for marketing. You know, in December, you're actually going to have a 12-month marketing plan with the, you know, obviously the ability to make changes on the fly, or, you know, per month or per quarter or per, you know, special occasion. But what happens mostly is, like, we just had Valentine's Day, and I had many practices that really have their stuff, you know, they got it going on, but yet they didn't post anything for Valentine's Day because it was forgotten, because there was so much going on at the end of the year. So really make that plan now for 12 months out, and you will not be sorry. You will never have to try to put a program together if it's done correctly. And I think it's like I said, not just in the marketing, but in all processes, tracking. I'm big on data. Like, I love last night that video, what was it called?
Show us the data. Show
us the data. Yeah. I'm a data girl, and everybody knows that's what I like. And like, let's talk about what you should be tracking, and really, it will make a difference in your practice, and it's imperative that you do it now.
And we were saying earlier, you know, 1 minute video is equal to, actually the metrics are about 1.5 million words, just because of, but yeah, I mean, I totally agree. And I think video is, if you want to connect with your patients and your community, you've got to do it through video, because people don't want to read anything anymore.
No, they don't.
You know, but I do think, speaking from the surgeon standpoint, I completely agree with your statement about, you know, surgeons get busy. I mean, there's people like, you text them, they don't send you anything back. Now there's people like, I'm nothing better than, I'm getting like 20 texts a day from, you know, but you know, back when they're working, people are busy, you know. And it's tough. It's tough to do these things, and the surgeon probably needs to be involved in some of these things. You can't just have your practice manager doing everything. It's just not going to work.
Well, and this is the time to utilize your staff that you're paying. Again, you don't have to do that, but you can work with them more closely. Ask them to put a plan in place and present it to you, and then work with them, something that you really probably haven't had time to do over the last couple of years. Yeah. Take advantage of it.
Yeah. And even, you know, any recommendations in terms of, you know, I'm sure like websites, they get stale, you can update your content. I mean, you do need to have some written content on there. You can refine that, because you'll have time to do that. Any recommendations about social media channels? You know, I think, sometimes people kind of want to develop certain social media channels, but haven't had time. But
this is actually the best time to be doing that, to ensure that you are doing your best and being best on social media. But I don't want to dismiss, I'm glad you said that, the website. We just were doing a big website secret shop for a lot of our practices for a program that we're doing through Enhance. And so Karen and Amanda both went through, and they were going through the websites, and this one practice, it's a brand new website, and we click on a link and it's broken. It goes nowhere. So you have staff at home, have them going through every single link on your website and making sure that everything's working. This is the time to do it. Look at those before and afters. How many times doctors say, I don't have time to go through all my before and afters and make them look nice, make them consistent, putting like what size implant they have, what they weighed before, all of the details that we know now makes a difference with your SEO efforts, take the time to do that now. This is the only time you're going to have to do it. And so again, yes, social media, but don't dismiss your website at all as well.
Yeah, and like I know we were talking earlier and saying how, there's a lot of people like, oh, like, woe is me, we got this unprecedented thing going on. It is, but like, you got to put your big boy pants on, and you need to like come up with your solution. Absolutely. And there's a lot. This is actually, with every challenge, there's an opportunity, and so this is the opportunity to do some things that you've never had time to do in the past 5 years.
Absolutely, and like I said, Amanda, Karen, and I, we are ready to help as well. I mean, we want practices to be great, and this is the time to be great.
And you all, you personally have been doing this, and I know that Amanda and Karen do a lot of this as well, and they've been very helpful to practices. I know at the end, we're going to give links and things where people can get follow-up information, input from you all. Absolutely. So that'll be great.
Yes.
Okay, so we're talking about this re-entry into practice. We don't know exactly when it's going to be. But again, anticipating that the best you can is going to be important. But what recommendations do you have? Like, so people start to get an idea when they're going to be able to start operating again, and how do they communicate that with their patients, and how what platforms should they do it with? What kind of recommendations do you have on that?
Yeah, again, I think it's going to go back to you have to do it in all platforms. And it, again, has to be well, but you can start filming that now. You don't have to have the exact date. Maybe it would be nice. I had one doctor's like, I'm just going to film 20 with all different dates, just so he was ready to go. I thought it was kind of funny that I don't think he's going to do that. But you social, Insta, Facebook, every avenue, have something ready though. And then so you can just insert the date. Don't wait till you're ready. Now let's try to put something together.
Right.
Make it fun. I've seen doctors, saying this is my new office from home, and they're in shorts and a really nice polo shirt at their computer. Patients love that. They want to see you. They want to see you being funny. But they, don't wait till it happens to put all of that together. Do that now.
Okay, so talk to me about like promotional pricing. You hear this a lot. Like, what do you recommend? Maybe you can kind of go through some of the scenarios. Now, you obviously have some people on your books now.
Correct.
The people that are, say, 4 or 6 months out, that's not as big a concern. But there's patients that are now being postponed because their surgery was this week or next week or the following week, and that those are likely probably not going to be able to have surgery. Right. What recommendations do you have? And then is there any place for any kind of promotional pricing?
Well, and again, you and I were just talking about that. I'm hoping that this, the legislation will be passed for the Small Business Association for the loans. And I think that financially is really going to help people, and it's going to help your patients. The problem is, first of all, is that when they come back, are they going to be able to take time for surgery? You can't go back to work after being off for 3 weeks, 4 weeks, 5 weeks and say, oh, by the way, I need to go take a week off for recovery from surgery. So I think, the first couple months back are going to be a little challenging. And I was thinking about this though, because people, the last week, 2 weeks, and maybe the next 1 or 2 weeks, depending on the timing, they've already paid for their surgery. And so people are going to ask for a refund. So you want to have a policy in place, but I don't recommend that you just put it out there for everybody. If you have a patient that calls in and says, I need a refund, talk about, well, we do have a promotional program, and I'm going to be very, straightforward here. I got it from the cruise industry, because we've been talking about the cruise, that, they've had to cancel cruises, and they are offering onboard credit for people to not cancel or want a refund, but just to reschedule and sail within the next, year or so. And we can I know that kind of sounds kind of cheesy, but just say, what, if we offer you, based off of the price of the surgery, $500 to come back into the spa or whatever you want to do, to just reschedule your surgery, is that something you'd be interested in? It's not something that you have to promote, but have it ready. Likewise to the people that have paid deposits, that their balance might not be due in, for 2 or 3 months for the surgery. If they're like, I need a refund because I'm not going to be able to have my surgery. Have that conversation. Again, have a point of contact in the office for somebody to take these types of calls. And that way your other staff isn't having to deal with that, and as well as you'll have a consistent messaging. But for these patients, same thing. Do you say, if it's a $20,000 surgery, we can give you $500 off the surgery if you just want to reschedule it. talk to them, make sure it's appropriate for them. If it's a $5,000 surgery, maybe it's only $250. I'm not a big discounter. You know that. I'm all about, I don't like working with low-cost leaders. I believe you charge for your surgeries and because you're worth that. But we have to be very aware of what's going on right now in the practice and in our world. But again, have a dedicated person and make sure that whatever you allow them to do, they don't have to keep saying, well, let me go check with the doctor. Give them the power and empower them to be able to make decisions that are going to be best for the practice.
You know, you talked about this in the first part. We were talking about virtual consults, and you were kind of making the point that it should be just like an in-person consult in terms of the steps that are taken. But what about, you know, this whole thing, like keeping track of patients who are interested and who have been talked to and are just waiting for the green light? What recommendations do you have for us on that?
Again, I think it's key. Like if you have that other contact person handling the people that are asking for refunds or needing to reschedule, your patient care coordinator really now has time to be able to constantly be reaching out to those patients and just seeing where they are. Just say, hey, gosh, you know, who knew that our world was going to stop for 4 weeks? So however long it's going to be, let's talk about where you are. You know, what, you know, are you needing, you know, do you still want to get on the schedule in May? And have that conversation with them. Have it incentives that if they want to come sooner, that, you know, that you might give them some type of a promotion or some type of a deal. Again, I think there's not one answer for every practice, but I think we have to be smart and we have to get in front of it. And again, this is the time to be putting those types of programs and thoughts into place.
And what in terms of, so you have a practice, say I'm seeing my patients, I'm doing my online consultations. Do you recommend, so, you know, we kind of, again, you kind of emphasize that we should be doing them the same way. So at the end, my coordinator will talk to the patient. That's generally, they talk, okay, would you like to schedule? Mm-hmm. So at that point, is your recommendation that we kind of have a best estimate when we think we're going to be operating and start having them earmark a tentative date? Or do you say, well, we will confirm this with you once we know? Or how do you do that? Because everybody's got to, you know, we're kind of, you got to start building your schedule out, but you know, you also have patients that you're trying to reschedule. So what do you recommend?
Well, and I think it's having that conversation with the patient and saying, you know, we anticipate being back. I keep telling everybody April 15th, that's my magical date, but I've heard some practices say April 20th. Mm-hmm. So if you'd like, currently we have these openings for that week, and some practices don't have openings, but by then they might. But what would your number 2 choice be? Let's say, you know, are you wanting to have surgery as soon as we are able to come back? And patients will tell you, you know what, I'm probably gonna have to wait 6 weeks. But have that conversation with them and make notes. I mean, in your practice management software, I know everybody calls that EMR right now, or just a note in your book. Like, be smart here. Don't make it difficult. Don't try to create this huge tracking spreadsheet. Just make it simple. The other thing, to your point, we were talking about being busy. I don't know. None of us know what's going to happen. You know, when you come back, every patient might stay on your surgical schedule. You might have 50% drop off. You don't know what that's going to be, but a lot of surgeons are like, I'm just going to take all my clinic days away and just, you know, do the surgeries. If you have your own OR, you might consider doing some Saturdays for those patients that you've had to cancel already or reschedule because of, you know, being told that you couldn't do the surgery. And that's not going to really have an impact then on your consult day, nor will it have an impact on your current surgical schedule. It shouldn't be that long because you shouldn't have, you know, if you're operating 4 days a week, there might at the most, you know, it might be 25 to 30 patients, right? Which you can pretty much get taken care of pretty quickly on some weekends.
Yeah, I mean, and that's, I think, the hope of everybody that we're talking about a 3 max 4 week delay on some of these things. And if that's the case, it's manageable, you know. And obviously, we don't like to think about the other options that it would go on longer. But I mean, nobody knows for sure. But, you know, based on the data that I've seen and the best, you know, known data like we talked about earlier, I don't think it's going to be longer than that. I really don't.
I don't either. I feel really good about that. I'm a very optimistic person. Mm-hmm. Like I said, I've been telling everybody April 15th, and some doctors are saying, okay, let's, you know, they just absolutely think that will not happen. They think it's going to go longer, but I think we'll be good.
Yeah. All right, next question is in terms of staff, okay. How about PTO? You know, if people have used their PTO time, in managing some of your staff challenges. And then we're back and we're trying to go full throttle and really get back and doing things, but then your staff has vacation plan and life continues. And so what kind of recommendations do you have?
Absolutely. And I think first thing is these are things that you need to be communicating with your staff now prior to coming back. And again, part of the legislation that they're trying to pass right now is that I think it would be retroactive, we think, to March 1st. And so if you are requiring your staff to use PTO right now, you might consider giving that PTO back. Means that you will be able to recover some money through some of the programs that are hopefully going to be passed soon. But I think it's communicating with them. I think it would be irresponsible of a practice to think that, gosh, you've had all this time off, so you're not going to get your vacation that you planned in September. I don't think that's a great morale booster for your staff after coming off of, they've been stressed out as well. So I think communicating with them, but having a policy now, setting that up and determining what that's going to be. I personally don't see it being a problem giving them an extra week or two PTO to be used in Q3 or Q4, obviously not in Q2 when we're coming back and we're needing them. But I think it's something that you talk through with your staff, and before they come back, have the policy.
And we can do that with our weekly staff meetings like
Correct.
you told us we need to be doing, so we can communicate
Absolutely.
these things. Yeah, because most people have probably been too busy to even think about stuff like that.
And I think it's imperative that they do that. And again, we kind of talked about, I've seen people doing, like I said, the social happy hours. I can't stress enough the importance of doing that during these times. It truly will be the difference of having a very motivated staff coming back and having one saying, I heard from nobody.
Right.
I think this is key to having a successful
reentry. So
reentry.
simple, and especially, 10 years ago even, or 15 years ago, it would technology, you could do, maybe if you could do a three-way call,
Exactly.
like that might work if you had,
Correct.
if your flip phone worked well enough. But now there's there's FaceTime and all sorts of stuff that you can do. So
I love Zoom, and I'm just now beginning to learn how to use it. I love it for these purposes. I think it really is. It's great for the practice to be able to use it, and you can see what everybody's doing.
Yeah, that's great stuff. And I know that you and I kind of keep checking our phones to see if there's an update on that proposed federal relief package for small businesses. And obviously that's going to have a big bearing on some of the recommendations. And so I know you'll be providing as a supplement to this series details of that.
Correct, absolutely. And I hopefully that'll be tonight or tomorrow.
Yeah.
Hopefully it gets passed pretty quickly.
So I think in conclusion, Sandy, this has been truly enlightening, and you give us an opportunity to really learn such a great deal from all your guidance. So thanks so much for being here. Number one, some of the things that you've kind of told us through this series is like, we need to be leaders. We're the CEO of our practices. We need to make sure our staff is comfortable and that some of their fears are allayed, and the way we can do that is by being a good leader. There's a lot of different options here. The surgeons and practices should really look at all the different options that are out there and make sure that they come up with a good plan that they formulate that utilizes those things. And then I think also, we'd like to not only thank you, Sandy, but Sientra for sponsoring this and putting this program and series on crisis management. And we're going to show a link here that will allow people to get in contact with you and your team for any follow-up questions.
Absolutely. And I want to encourage people, like I said, we have been doing this for many years. We have our monthly webinars where we have a series for physicians and practice managers, a series on marketing, and a series for staff education. And we're continuing to do that, but we've kind of upped it throughout this process to make it, there'll be live webinars where practices can actually interact with us. So I encourage them to actually go to our Sientra Education Forum website. We have them listed there. Get with your local practice plastic surgery specialist, your PSC, I should say plastic surgery consultant through Sientra. These are great tools. And again, let's educate your staff and let's be smart. I will be so disappointed in any practice that comes back or calls me 2 days before they're ready to go back in and say, what should I be doing? It should already be done. So I think, like I said, be the CEO, be the leader, and it will be great when we come back. It really will.
Yeah, no doubt. And I think as surgeons are seeing this, they're probably thinking of more questions, and I would highly recommend you contact Sandy and her team, because as she said, they've been doing this for many years. This is not something they just all of a sudden decided to offer a CVD-19 like practice management series. They've been doing this for as long as I can remember and doing a great job at it. So,
and I'd like to thank Plastic Surgery Channel and you and
Sure.
Terry. They have made this very easy, a very easy process for me and for our team. And we appreciate all you do. And I love all the things that you've shown me today because it is something I'll probably start talking to more surgeons about because it's great stuff. So thank you for being
Absolutely.
great as well.
And we always end this with the kind of public health message of the people, for the people, and by the people. And just remember, we will prevail.
You will.
Thank you.